Professor Schneider. South Africa is probably one of the best examples that India can have in terms of its own commitment to overall social justice and equity, but also grappling with a multitude of challenges in terms of political issues. But the aspiration for universal health coverage has been very strongly reflected in South African policy. How has research helped that?
Okay. Thank you very much, Chair. So I'm from South Africa, and just reflecting a little bit on my context and the role of HPSR in that context. I'd like to suggest three key roles for HPSR in advancing UHC. The first is the necessity to keep the whole system in focus, and that point has already been made by one of the other panelists. Secondly, recognizing that these new international ideas actually are implemented on old systems, and how the new ideas meet old systems is absolutely crucial, and HPSR has an important role in looking at that interface. And then thirdly, I think HPSR has a particular role to develop methodologies for evaluating unfolding processes of implementation, not only to look at outcomes and whether goals are achieved, but to actually from very early phases of implementation to look at how actors, processes and systems interact in the implementation process, and to provide very rapid feedback to the policymaker environment. But before I talk a little bit more about those three ideas, I'd just like to say that UHC as the apparent new global consensus and the likely core element of health goals in the new post-MDG platforms is at heart a health system strengthening concept. And that represents a shift from the previous era of MDGs heavily focused on the major causes of mortality to quite a square focus on the delivery systems that interventions for those main disease burdens require. And while HPSR has an important role in advancing UHC, I think UHC is offering HPSR very particular new opportunities. So coming to my 3 points, my understanding is that UHC has arisen globally in response to the problem of out-of-pocket payments, that health has constituted a source of catastrophic household expenditure in many parts of the world, and leading to, and becoming a significant cause of household impoverishment. And UHC then is correctly focused on financial risk protection and on financing reforms, on how money flows through systems. UHC in South Africa is being referred to as the National Health Insurance. And that set of proposals is essentially about bringing together two very divided systems, historically a public and a private sector. And bringing, first of all, the funding from those two sectors together, and secondly, to create an environment of provision where those sectors really form one pool of providers. And to achieve that requires the buy-in of enormous numbers of people and very, very significant reforms, in particular to the hospital sector in South Africa, which I think has some parallels in India, which very briefly require a very big improvement in the quality and experience of public sector hospital care, and a great increase in the efficiency of the private sector hospital delivery. And so that's been quite a big focus of the deliberations around NHI, and has also prompted a set of reflections then on the role of the primary healthcare sector in enabling, if you like, efficiencies at the next level. And leading people down a pathway of suggesting the primary healthcare sector's role is primary care and as a gatekeeper for the hospital sector, and stripping, if you like, primary healthcare of a very comprehensive set of ideas that are very important in the country and have been part of the policy process and that have involved significant, for example, developments around community-based services. So that's the danger of a process that starts with financing and doesn't see UHC in a very comprehensive sense. And if one looks at the definition of UHC, it's much more than financial risk protection. It's about equity and access, services matching needs, and about improved quality as well. So the need for HPSR in the design, if you like, of these new systems to be alert to the effects on the system as a whole, and how these new designs may actually ultimately undermine the overall goals and the end goals of UHC. So that's the first point. The second is that UHC is a set of new ideas, but in fact, at the point of implementation, they all seem like old ideas. Actually, and we've been doing, that's what health systems have been doing for years, improving access, equity and quality, trying to do that. It may involve new financing modalities and payment systems, but really health systems have been doing these things for decades. And these new ideas that may sometimes become stripped of meaning, actually, these universal mantras when they hit countries, and so it's important to recognize that these ideas finally have to be implemented in systems that have particular social historical contexts, particular configurations of financing, human resource delivery systems, particular values, and all of that offering a set of constraints and possibilities that aren't necessarily always immediately obvious and are not provided as answers when the documents come from WHO. So, I think there's a particular role for health policy and systems researchers in providing an understanding of systems in very holistically, but also to be able to see where the leverage points are in the systems and possible positive possibilities in those systems and points of anchorage of new ideas and policies in those systems. And just to, I think another kind of example around that is performance-based financing in many African countries. Performance-based financing is sometimes seen as a way to promote financial incentives to improve the performance of individual providers. And when implemented in a simplistic way, as a universal blueprint, leads to very different effects across countries. So, performance-based financing has been attributed to some of the major positive developments in African health systems are attributed to those kinds of systems. Well, they also have very bad effects in other systems. Okay, so then the third and last point is about research and research methodologies. I think that is an area for methodological development that begin to understand processes of implementation, particularly, I think, in the early phases. UHC is an example of whole system change, and whole system change requires implementation through complex systems in ways that are not totally predictable, and that will produce unintended consequences. So health systems researchers need to be able to look at those phenomena and to find ways of studying them and provide, if you like, early warning signals on where things are going wrong. And I think in doing that, to always bear in mind what the ultimate goals of UHC are, which are to ensure equity of access.